This conference will now be recorded.
All right, go for it.
Welcome, everybody. Today is Monday, August 31st, 2020, and it's 3:01 p.m., and this is the Lincoln County Board of Commissioners meeting being done remotely due to COVID-19. I will go ahead and call the meeting to order. I have Commissioner Hall and Commissioner Hunt both here, so we have all three commissioners, and that's a quorum. I will say that I have to leave today in exactly an hour to attend to a pretty urgent family situation, so I'm going to let Commissioner Hunt take over as chair today so that the meeting can kind of smoothly continue if I need to leave. As I anticipate we have a full agenda and we'll probably be here longer than 4. So I will let Commissioner Hunt go ahead and chair the meeting today. So I will hand it over to you, Commissioner Hunt.
Okay, thank you, Chair Jacobson, and we'll understand when you virtually vanish, I guess, around 4 o'clock, so good luck. All right, as Chair Jacobson has indicated, we do have a quorum present at the moment, all three commissioners. Next item on the agenda is recognitions and proclamations, and we have a resolution recognizing 2020 National Preparedness Month. I believe our presenters are Emergency Manager Jenny Damaris and Assistant Emergency Manager Samantha Buckley. I do not have a copy of the resolution. Commissioner Hall, do you? I know traditionally you read these.
I do have a copy and I'd be happy to read it, Mr. Chair.
Thank you.
Proclaiming September 2020 as National Preparedness Month in Lincoln County. Whereas National Preparedness Month, occurring annually in September since 9/11, creates an ideal opportunity for community members, businesses, and visitors of Lincoln County, Oregon, to join other community members across the United States in preparing their homes, businesses, and communities for any type of emergency, including natural disasters. And whereas the U.S. Department of Homeland Security and other federal, state, and local officials in the private sector are working to prevent and respond to all types of emergencies. And whereas when individuals take responsibility for preparing their families and their communities, the chance of survival and return to normalcy following a disaster is greatly increased. And whereas the Lincoln County Sheriff's Office Emergency Management Division partners with federal, state, local, tribal, territorial, private, and volunteer agencies to inform individuals on how to take action through our public education campaigns and our local volunteer programs, such as Community Emergency Response Team, American Red Cross, U.S. Coast Guard Auxiliary, law enforcement volunteers, and amateur radio services. And whereas residents, businesses, and visitors of Lincoln County, Oregon are urged to plan ahead for disasters and encourage their family and their friends to also do so by participating in neighborhood preparedness activities, registering their contact information in the local emergency notification system, Lincoln Alerts, and participating in annual readiness events. And now, therefore, we, the Lincoln County Board of Commissioners, do hereby proclaim September 2020 as National Preparedness Month and encourage all community members, businesses, and visitors to develop their own emergency preparedness plan and work together toward creating a more prepared community.
Thank you, Commissioner Hall. Ms. Damaris and Ms. Buckley, share your thoughts with us. I can't see you, so if you're talking, you're muted. Okay, you're saying you know. Okay, Commissioner Hall is through.
Just seeing a message in chat from Ms. Damaris. We no longer hear Commissioner Hall. Is the audio still working? So perhaps
we cannot hear them.
Yeah,
Casey?
we cannot hear them.
Everything looks okay on this end.
Well.
Okay, so we apparently I don't know if they can hear us or not. Apparently not. We hear each other. Well, I guess I'll ask Chair Jacobson any comments at this point.
Boy, I picked a good meeting to have you chair.
Yeah, I'll
Sorry about-
remember your kindness.
Yeah, it's too bad we can't hear from Jenny and Samantha. I would say if Sheriff Landers has anything, maybe.
Oh, there she
yes,
is.
we hear you. Yeah, so I'm not sure why one phone worked and we transitioned to another, and so we were able to get back on, so we can hear you now.
All right, well, Commissioner Hall has read the proclamation, and we're happy to hear your comments.
Great, and we'll just take a few brief moments of your time. First of all, we know that this year for National Preparedness Month is unlike any other month that I've had here in my 8 years of service with the county. I'd first like to thank those regular partners that assist us every single year with an amazing emergency readiness fair that we are unable to host this year. So a big shout out to our preparedness partners at the American Red Cross and Northwest Natural Gas. They are our co-hosting sponsors each year, and they will definitely be with us next year when we have to reach our goal of hosting that preparedness fair again next year. So this year, as you would imagine, we are focusing on virtual preparedness information through social media, our very own Lincoln Alerts program that we're able to provide information to our email accounts of those folks that have opted in. And then, of course, we are following along with the National Preparedness Campaign. So their weekly themes for this year, the first week will be to make a plan, which one for your car, one for home, one for your workplace. If your children go to visit grandmas and grandpas or other family members, it's always a good idea to make sure that they also have a kit there for your kids when they get there. And then the next week, leading right into that, is building a kit. So same thing, making sure that you have those kits available. The third week of September is prepare for disasters in general. So they're going to be talking at a national level about all hazard events. And then the last week, we'll follow up with Teach Youth About Preparedness. And I would just tag on there, we have a really amazing school district youth CERT program that really helps engage those youth members to participate and become volunteers in their communities wherever they may stay here or move on. So Samantha Buckley, who is our AV media, social media guru, she takes care of all of those things for us. So she is going to talk to you a little bit about the 2 webinars that we're going to host. And then I'll finish off with what the American Red Cross is also hosting to support our communities.
Sure. Thanks, Jenny. Can you all hear me okay?
Yes.
Great. Thank you. All right. So like Jenny said, this year is a little bit different with us doing some virtual events instead of an in-person readiness fair. So we will be offering 2 free webinars that are open to the public. These are intended to be educational opportunities for our public to call in and learn and chat with us so that they can still see our face and get some educational materials. The first one will be on September 16th, and it will be focused on these new tsunami evacuation maps offered by Dogami. They're neighborhood tsunami evacuation maps. We'll be looking at them online, and we'll show people how to locate their own neighborhood and print those maps off from home. And the second one will be on September 23rd, and it's going to be we're going to poll the community, and they're going to select the topic, which is really fun. We've not done this before. So we'll be offering them the opportunity to either comment on our Facebook and or use a Smartsheets form to pick the topic. The options will be getting your finances ready, animal readiness, or food and water preparedness. And then depending on which one gets the most votes, we'll prepare a webinar on that topic and again, offer it to the public. For both activities, participants will be asked to register online so that we can get the link to the folks who are interested. And that link will be provided in the media release as well as on our website for registration and on Facebook. So that's going to be fun.
Yeah, something new. And then what we're hoping is this will give us sort of that platform to determine what works well for our community, if evening time works well, if perhaps a Saturday morning works well, and then we'll be able to record these webinars and make them available on our website link. So if they're not able to join us that evening or that daytime, then they can click on it and review it anytime they would like. So also our Red Cross partners, they also, because they are very active during Preparedness Month, they are hosting a home fire safety, an earthquake safety, a wildfire safety, and a flooding safety webinar for individual ones, one each week, also during the month of September. So we coordinated ours to not conflict with theirs, and that's why we're not offering those particular subject matters this time period, because they were gracious enough to host those for us. The last thing I would like to add is to also think about next month, October, is the Great Oregon Shakeout. And even though we're still in these physical distancing timeframes with COVID, this is still something that all community members will be able to participate with at home, if they're at work, wherever they may be, because it is on your own accord to practice your drop cover and hold on. So we'll also be hosting some more earthquake mitigation type webinars during the month of October to tie in with the Great Oregon Shakeout. So we would be happy to entertain any questions that you might have.
Chair Jacobson, I'll let you go first.
No questions at this point. Just a big thank you to you and your team and all of your volunteers. It's been quite a year for public health and emergency management in the county in general, and I feel like many of the things that you had been practicing for and preparing for, while maybe this isn't the emergency we thought would be coming, I think we always thought the big one would be our big one. I just want to say a big thank you to your staff on taking on all the additional responsibilities that you clearly have taken on this year. So thank you.
Thank you very much, Commissioner.
Commissioner Hall.
I couldn't have said it better myself. I definitely second everything Commissioner Jacobson said. And I don't know, just one question that occurs to me is the fact that we are living through an emergency of a different sort, but a very real sort, a pandemic. Do you find that maybe this is heightening people's general awareness of the need for preparedness, the kind of things we talk about, whatever the event is, being able to survive on your own, knowing, a lot of the basics that can apply in multiple situations?
Great question, Commissioner. And when we do our Cascadia presentations, they really are focused more towards the all hazard event. And we found multiple times during the initial part of COVID, when we saw our community members sort of sheltering in place, whether it was voluntary or they were requested to do so, that for those that did have their emergency preparedness kit, their 2-week plan ready at home, those things they would have had in their cache at home were those things that they would have needed for the COVID event, whether it's a face covering, hand sanitizer, enough food and water to get you by so you don't have to go to the grocery store, medications if you're able to have additional ones on hand. And then it also really emphasized that community neighborhood preparedness. So if you were relying on friends and family or other neighbors to cohort together to get those resources to you, it really sort of put that community logistics together. And again, seeing more people volunteer their time for the good of their neighbors.
Excellent. Well, thank you.
Okay, so thank you both. I have a question. You talked about a plan, and I know the webinars, that sort of thing, will provide more details, but what are the key elements of a plan? I mean, I know there's, staying in place, food, communication, but maybe you could just elaborate on the key elements of a good preparedness plan.
Another great question. Well, one of the areas that I find family members don't spend very much time on, what you mentioned there, Commissioner, was communications. We are so interactive with our immediate family members that we don't take the time to really discuss the what ifs and where will you be and how will I meet you. And we have found, even though there's a nice little books, you can kind of write things in, that really having the one-to-one conversation with your immediate family members and those that maybe live a little bit further away. so that you're both on the same page of what to happen if I had a wildfire in my community. I had to immediately evacuate. What if telecommunications were down? We had several instances where we had partial phone outage, and that really affected that community's ability to intercommunicate with their family members. So having that backup plan that everybody kind of knows what those options are. And the other one I would leave you with, Commissioners, really thinking about the family financial readiness, whether it's a small savings account, re-looking at your insurance policies to make sure that you really are fully covered for those worst case scenarios and things you may not have expected, updating the value of your property with your insurance agent, looking to make sure that you have the important documentation in place, that it's mobile or secured somehow, either digitally. So if you have to immediately leave your property, you can't gather all of those items, that you will have access to those important documents.
Okay, very good. So you provided a segue to my next question. Thank you. You mentioned wildfires, and I know our county has provided support to other jurisdictions that are battling wildfires. Wildfires, as I understand it, are quite an issue presently in our state. Maybe you could comment about the support we provided in wildfires as an issue statewide.
Sure. I know that I think at least 3 of our own local fire districts were part of the CONFLAG team that assisted at the Mosier Creek fire. And I think there was also an invitation at large for some of our fire districts to be able to travel to other locations such as California. But I'm not sure that any of our resources were actually deployed for that. It's sort of like a co-op group for the fire district. So whoever is sort of furthest away, least affected, or low probability, they generally tend to get called first to determine if they have a cohort group of multiple districts that will make one sort of strike team. Lincoln County is very well known for the availability and the strength and training of our local fire districts. We have 8 of them, and they all work together. So it's not that just one district will go as a team, that they'll put several engines and all mixes of firefighters together to make that one strike team. We have quite the credibility in the state for their abilities to do so.
All right, well, thank you. And that speaks highly to the caliber of the people that are involved. So good work, and appreciate all your efforts to help the county and our citizens and people be ready when the event comes, and not only for the event, but for other emergencies that unfortunately may occur. So I'd be happy to entertain a motion.
Mr. Chair, I move that we proclaim August, wait a minute, I'm sorry, I better double check. It's actually September as 2020 National Preparedness Month in Lincoln County.
And I will second that motion.
All right, it's been moved and seconded. Any other discussion? All those in favor signify by aye. Aye.
Aye.
Any nays? All right, the proclamation is recognized, proclaimed, and again, thank you, Ms. Damaris and Ms. Buckley, for your presentation. We appreciate the hard work you both do. All right, with that, move on to the adoption of the consent calendar. These are items of a routine nature or items that have come before the board before. If staff or commissioners wish to comment on any particular item, you may do so. Otherwise, I'll entertain a motion to approve the consent calendar.
Mr. Chair, I move for approval of the consent calendar as presented.
And I will second.
Been moved and seconded. All those in favor say aye. Aye.
Aye.
Excuse me, I'm looking for my pen. I found it. All right. Next item on the agenda are reports. And as is become, I guess, sadly a routine, this is the time when we discuss the pandemic, and there's several items on the agenda that sometimes blend together, but certainly the first 2 would be an update from our public health director, Rebecca Austin. And I know we have one of the co-chairs from the Public Health Advisory Committee with us today, Gary Lehman. I believe Jackie was unable to join us. So we'll start with Director Austin.
Yes, good afternoon, Commissioners. This is Rebecca Austin, the Health Department Director, and I can give you a quick update. I don't know, Christy, did you get some updated data sheets too? That is going to go up?
I haven't received any updated data sheets, no.
Oh,
I
Okay.
did receive them. I think they might have come directly from Susan sometime in the last couple of hours.
okay. So I probably need to look in my email then. I was hoping they could be up on the screen. Let's see. I can find them.
The ability
It
to
was an 11:23 email from Susan.
Got it. Thank you.
Narrow it down. Yep.
Great. So everybody, all the commissioners have those? So, let's see. So I will update you on our numbers, 463 positive cases, 7,607 negative cases. We've had a total of 23 people hospitalized and 13 deaths. And the state is, for whatever reason, has updated our recovered rate from, I think it was 28 for the longest time, to 31. We're not really sure what's going on there, but that is a number that the state is responsible for updating. And I think when we, they got overwhelmed soon after everybody started moving into phase 1 in mid-May, and really haven't been updating those numbers for recovered. So I know that's confusing and concerning to a lot of community members. So I just wanted to say that we are aware of that. OHA is also aware of that. And it's not a piece of data that we have any control over at the local level. So I just want to bring your attention to our updated data sheets that we have been looking at. I think now this is the 3rd meeting in a row that we're focusing on the data here. So this first one that's, so you guys aren't seeing this, right? Is that right? I mean, it's not up on the screen, but you have them.
Christy's sharing there.
Oh, it is up now. Okay.
Yeah, I've got it on my phone.
Yeah, I'm looking at it on my computer too. So sorry about that. So anyhow, here are the numbers of our cases and how that is moving over time. So you can see still it's, you know, kind of up and down. And Susan has graciously added a few more tags so we can see kind of policy-wise what's happening in the last couple weeks, which is really helpful, I think. So that's the cases. And then the next one is an interesting report that shows on one side the number of tests that we've done, which is the right-hand vertical column is the number of tests, and that's shown by the brown and the green, or the tan and the green bars. And then overlaid on top of that is our positivity rate. And so I just want to go, and that's on the far left-hand side, the numbers. So you can see a couple weeks ago, we were at the 10% level, and probably is starting just after that. It says in red, data are incomplete for the most recent dates. So the following weeks, the 22nd, and of course this week, we don't have any data yet up. But every time we show this, we have this steep decline down. We're thinking, oh, yay. But really what's happened is that the data isn't in yet. So the data for the positivity isn't in yet. And probably there's some adjustments for the testing as well, though probably not as severe as the positivity rate. So it's
Christy,
not-
can you share that slide? I don't see it. I'm still on the COVID cases slide. Excuse me for interrupting.
Casey,
Oh,
share.
yeah. Yeah.
Or
if you could-
Casey?
Yeah, I don't have it at this time.
Okay.
Oh, okay. So we just had that one. Okay. So, I need to go back to my screen. I can see it. Yeah. So sorry about that. But anyhow, the drastic decline just means that it's not accurate and the data isn't all in yet. So you can see that since about mid-July, our positivity rate has been climbing to the point where we were a couple weeks ago at 10%. So that's not good. I think we need to be at 5% to meet the metric. So we're not seeing a decline yet, which is something that we would want to see before we make any moves to open up any further. So we're going to have to kind of hang in there and see what happens for next week, for the week of the 22nd, to see what happens with that positivity rate. And then the next slide is the age distribution for all of our COVID cases. And again, there's not much difference there. The 20 to 29-year-olds are still in the lead. And then it kind of steps down till the 70, 79-year-olds. It keeps stepping down. And then the 80 plus, it bumps up a little bit. And then we took that data and overlaid the different kinds of cases that are confirmed. So the green bar is the clusters, which is kind of like our events or close contacts. I think they're going to kind of merge those two. You can see a new color emerging on this chart, the blue. So the blue and the green, I believe, are very similar. Like close contacts. And then the HH stands for household. So that's who in your household is confirmed or presumptive. And then the yellow is the outbreaks, which we know is our contributes to most of our cases. And then the SP is the sporadic or the community transmitted. And that's in the red. So, and it makes sense for the 20 to 29-year-olds all the way down to the 59-year-olds to have the biggest outbreak spikes because they are in the workplace, right? So they are, and then when you get up to the 80-year-olds, that is our long-term care facilities. So that we've had 2 outbreaks in 2 different long-term care facilities in Lincoln County. And then the sporadic is, I'm happy to see that that number is actually coming down. You can't see that here necessarily, but I know from another piece of data that we have that the community transmission has kind of been bouncing all over the place, but it is coming down. And again, you can see that it's the highest in our younger population, and probably indicates that they're the ones that are being more social. So it's harder to track those down. And then the last data piece that we've been looking at and sort of fussing with a little bit is the cases by industry. And I'd like to keep tweaking this one because I think it'd be helpful for you to be able to see at least the last week so you can see what the change is. But the biggest change here is in our restaurant and food service in Lincoln City. Last week when I showed you this chart, we were at 10 cases, and this week we have doubled that with 20. And that kind of makes sense to us with the Inn Spanish Head outbreak. So I think that, we're going to play with that some more and get you some data so you can see at least 2 weeks side by side, so you can see that there's that not much other has changed in that, but I did want to highlight that area. So is there any questions about the data? Is there anything that you would like to see that you're not seeing? Because we can always do some data diving to dig more stuff out if you would like more information on anything in particular.
Chair Jacobson, I'll let you go first.
All right, thank you. I appreciate the data dive. I think it's really helpful both for us in making decisions, but also and for the public to see what's going on as well. I don't have any additional data requests at this point, other than to say that I think to continue to keep up with this as we've done the last several weeks, I think that would be really helpful so that we can see it continuously. And then I had kind of a somewhat related question I was hoping I could ask you, which is I think at our last week's meeting, you talked about the need for additional contact tracers, as we had a few people that had to go back to their regular employment. I think we had a couple of other contact tracers that were actually hired by the county for other jobs within public health, and so we needed to kind of replenish again. And I just wanted to find out if we have identified people, if we are still trying to recruit people, kind of where we are at on rehiring.
Yes, sure. Thank you. And thanks for that opportunity to say that we were looking for people, because we got immediate responses from that. People that are following these meetings and are very interested in helping out. And so we did find 2 English speakers and 2 bilingual folks that we are getting up to speed as we speak. So that was a very successful recruitment at one of your board meetings, and I really appreciate that. And we're excited about it. So yeah, we have 4 new contact tracers coming on board.
Good. And is those 4 that you've identified, is that filling the hole, or do you still need to identify others?
I think we're good for right now, Commissioner. I think we're gonna get these 4 up and running. They're all very flexible, willing to work. I think we're gonna sort of stall right now. I do have started a list of people that are interested, but I think we're gonna wait a few weeks to get these 4 up and running. And then if I need to call more, I do have a list to call from. So I'm excited about that.
Great. Okay, great. Thank you. No more questions from me at this point.
Okay, thank you. Commissioner Hall.
Thank you, Vice Chair Hunt and Director Austin. So to follow up on a comment you just made, you mentioned that these 4 new folks are flexible. And were you referencing, I remember at last week's meeting, you said one of the things that needed to happen was essentially to make contact tracing a 7-day-a-week operation. So are you indicating that at least some of these folks are going to be available to do weekend work if necessary?
Absolutely. That was one of the first questions I asked them when they called me. So yes, we'll be in a full 7-day operation when they get on board.
Excellent. And another recruitment, because again, I think just acknowledging the fact that people are paying more attention to our work than ever before. You know, Nicole Fields, who was the Deputy Public Health Director and a regular face and voice at these meetings for several months. We know that she left the county not too long ago to pursue other further educational opportunities. Certainly a big loss to the team, but can you give us an update on how the recruitment is going to fill that position?
I can, yes. So we have gotten it down to 2 candidates. We had them on site last week for a panel, more informal interview. They went on a little tour and we had a meet and greet with the public health staff, and now we're in the process of hiring somebody. So I should be able to announce that fairly soon.
Well, that's great. I mean, I know it's an important position all the time, but especially in the middle of the pandemic, I'm glad to know that you won't have too much downtime with that position.
Absolutely. Thank you so much.
Excellent. Okay, I don't have any other questions at this point.
All right.
Commissioner Hunt,
Sure,
sorry, I have one
Go
more
ahead.
question.
sure.
We have someone that actually made a question in the chat feature, which is not a feature we typically use. But I just thought I would go ahead and read it. And that was, can someone address whether Lincoln County will be falling back to the requirement of symptoms to get a test, or have we never really moved away from that requirement? And I know Samaritan actually does the bulk of the testing in the county, not actually the county, but I just thought if Rebecca could address that.
So the question is, if we required you to have symptoms to get tested?
Yeah, the question was, will we be falling back to the requirement of symptoms to get a test, or have we never really moved away from that requirement?
Oh, well,
I'm not sure requirement's the right word, but go ahead, Director.
Well, wasn't there an announcement from the CDC essentially saying that asymptomatic people shouldn't be tested any longer? I think,
yeah, so
assuming that's what the person's
I think
referencing.
that's what they're referring to, yeah. So it is, when it comes to close contacts, we like to test people. We generally do it for the more high-risk people. And of course, it just helps us get our arms around the problem if we can test people, because there's so many asymptomatics. So we do try to test people that do not have symptoms, but it all depends on the circumstances. So we're not going to change our practice regardless of what the CDC says. And I did note that even the CDC said that it can, those decisions can be left to the locals in the state. So I don't know what that's all about. It feels like the CDC is kind of becoming politicized here, and that is very disconcerting. So we are going to continue practicing the way we've always practiced, and it just depends on what the circumstances are when whether we get people tested or not. And sometimes it depends on them, if they're happy to be in a household and with other people that are positive and just kind of monitor themselves. Of course, our contact tracers check in with them all the time, and that is fine too. But if they want to get tested, we get them tested. And I do think that helps with transmission rates too, just getting our arms around the problem. So it's not as easy as it's not a yes or no question, sorry to say. And I have no idea what the CDC is up to with saying absolutely no testing asymptomatics.
Well, excuse me, Commissioner Jacobson, anything more?
No, like I said, that I guess I'm not sure who Dennis is, but he's on our meeting and had a question. So I was just reading that on his behalf, and no more questions from me.
Well, I'll follow up because, first of all, we can't require anybody to get a test regardless. Is that not a fair statement, Director?
I would say the only people that are required to get tests are if they're going into the hospital for a procedure, and then they are
elective surgery.
Yes.
But that's a requirement of the hospital, not the county.
Right, exactly.
So if I can kind of restate what you said, as far as our procedures in dealing with individuals that may have been in contact with the virus, or may be showing symptoms of the virus, or may not be showing symptoms of the virus, we're not changing our procedures from what they have been in the past.
That's correct.
Okay. I think that hopefully helps answer the question. All right. I have a couple of questions. First of all, comment on the difference between a contact tracer and a caseworker? Or am I just using the same words, four words for two of the same people?
No, they're two different things, and it's not a case manager, it's a case investigator. So
Okay.
the case investigations happen when we get a positive test. It comes to us electronically, and nurses, our CD nurses take those. Yeah, pretty much. When we had our big spike, we did train up some other people that were non-nurses, but they pretty much gone back to their other jobs now. And our nurses have, and we have hired extra nurses to help us with this. So that's a job that the nurses call up the positive case and get as much information from that positive case as they can, like where they work, who's in their household, other contacts that they might have had in the last week or so. And just a lot, there's a, you know, it takes about 2 to 3 hours for that interview to happen. And then from there, all those contacts get pushed over into another database and get assigned to our contact tracers. Then the contact tracers call all those contacts and say, you know, I'm sorry to tell you this, but you've been exposed to COVID. And so we're just calling to tell you that you need to isolate for the next 14 days. We're going to be sending a letter out to you so you have the dates, how long you'll be in isolation. And we want to make sure that you're healthy during this time, that you have the resources you need to stay isolated so you're not going out to the store. Because you could have it and just not have symptoms. And then of course, if you have symptoms, and they have a checklist that they go through every day, they call those people up or text them and run through the list and determine at any point during those 14 days, they can suggest that somebody goes and gets tested. And the people themselves say, yeah, I want to get tested. And so we tell them how to do that.
But it still requires a referral from a physician, correct? Or a primary care provider?
It does, yes.
Okay. All right. Then I guess I see a bit of a dichotomy between what I think is one of the priorities, or should be one of our priorities, and that is to get our classrooms reopened for in-classroom instruction. And yet, when you look at the data we've got, and we're in phase 1, the age group, 20 to 29, which is a little bit older than their high school age students or younger, but certainly close. You know, that's one of the areas where we're continuing to see the highest percentage of cases. And then well, I guess if we go to phase 2, then you open up sporting activities, which to me seem, okay, we're trying to get our schools open, but if we do go to the next step, we may be taking steps that make it more challenging to open our schools or to keep them open. Is that a fair assumption of some of the challenges?
So let me just make sure I understood your question.
Let me start over. What I'm concerned with is I think we need to get our schools open, and yet when you look at the current cases, our younger students, younger people are getting most infected, and phase 2 would create more environments where the young, who we already know are the most infected on a proportionate basis, would be more exposed.
Well, I think I will stick to my point that I've made pretty consistently, that I don't feel like we can do both, move into phase 2 and open our schools.
Okay.
Because I think opening our schools, for me, looks more and more like a phase 3. So just more people moving around. It'll be interesting to see with Labor Day coming how things happen, because in a lot of ways I feel like we have moved into phase 2 because there's just so many people around and they're coming from all over. And I just think, I've always thought that just puts us at a much higher risk. And
well, I think
the data Proving that.
You articulated what I was trying to say. It seems difficult to do both. Thank you.
Yes.
Any other questions or comments from commissioners on the phase 2? Otherwise, I'll ask Gary Lehman to provide some comments about the Public Health Advisory Committee, and certainly Director Austin, you're welcome to join in.
Yeah, this is Commissioner Jacobson. I do have a couple of things I just want to say to what you just had said about phase 2. One is we were corrected after our meeting last week, or maybe it was the week before. We were corrected by Dr. Gray, the Lincoln County School District Superintendent, that just because, we get into phase 2, assuming we get into phase 2, that does not mean that school sports automatically start. And so I just wanted to clarify that because you had just mentioned that school sports would open. That's not necessarily the case. They have several other guidance and things they have to follow, so it doesn't mean that those automatically go back. They have other guidance there they have to be held accountable to beyond being in a phase. Additionally, I just want to be clear that we currently don't meet the criteria to get schools open. And then the other thing that's a little bit interesting is that in the counties throughout the state that meet or are hovering around meeting criteria to meet the exception to get K-3 in-person schools back, those are all phase 2 counties. And so while I think there's a trade-off discussion, I think there's also something to be said that if you can't kind of handle being in phase 2 and having people, socially distance and go to a movie for 2 hours, you're probably not going to be able to handle having schools open either. And so, like I said, just to note that those counties that are hovering on being able to get K-3 back are phase 2 counties.
Thank you. That's good clarification. I appreciate it. Anything else before we go to Mr. Lehman? All right. Gary, and again, Director Austin, feel free to join the conversation, and then we'll kind of blend everything and see what we come up with on the discussion of phase 2.
Hello, everyone. My name is Gary Lehman. I'm a co-chair of the Lincoln County Public Health Advisory Committee. If you would allow me to editorialize a minute, I want to just thank the health department. I'm wearing my special t-shirt here that says vaccine causes adults. And that's just a reminder. I got my flu shot last week. The flu vaccines are available at this point in time, and I highly recommend that everyone go out and get one. And the earlier, the better. So that's, keep that in mind. Vaccines do cause adults. I think Doug asked me to come today to make a few comments. The commissioners know that the advisory committee sent a letter last week, or our last meeting, I believe it was on August 4th, and we sent a letter to the commissioners on the 5th. I would like to, first of all, thank 3 people, Nicole Fields, who's departed, and Susan Trachel and Rebecca Austin, because those 3 individuals have come to all of our advisory committee meetings since the COVID pandemic began, and they spend a lot of time advising the committee, answering our questions, doing more or less the same thing they do with you. And we have tried to stay out of their way because they're doing a very good job. They're answering a lot of questions, and they're really working hard. So I just wanted to thank them for spending time with us, because I know their time is very precious now. So Doug asked me to comment a little bit about this recommendation that we sent to the commissioners. And first, let me note that we meet on a monthly basis. To my recollection, we have not made any recommendations in a number of years to the commissioners. But we felt after viewing the county commissioners meeting on the August 3rd, I believe it was, when the vote was 2-1 to apply to go to phase 2. After reviewing all the data, the committee, by consensus, felt that it was going a little bit too fast. And I had originally suggested that we form a group and talk a little more. But that was kind of shot down by the committee. And the committee said no. By consensus, they wanted to send a letter to the commissioners saying, hold on, we feel that you're going too fast. And I think a month ago, that was primarily because we hadn't really attained the level of mask wearing that we have now. And we were being inundated by tourists, which we still are. And we got a sense from the employees of the department that more or less they wanted to slow us down a little bit as well. So we drafted the letter and made that recommendation based on the feelings of all the members of the committee. And I might add, we have committee members from Yachats, a new committee member, Dennis White, who's from Depot Bay area. So I felt that we had a broad sense of the feeling of the entire county. And that was one reason why I supported sending the recommendation letter. Now, you folks have the luxury of getting these updates from Rebecca on a weekly basis almost, and I appreciate you taking the time to do that, and I try to listen to them. We only meet once a month. We're meeting tomorrow. So we will again look at the data, and if we feel like we need to make a recommendation, we will do that, although I think right at this point, we'll wait and see. I did note that in the letter, we recommended that the county not make application to move to phase 2 until September 21st. And the reason we did that was because of the Labor Day weekend, and we wanted to wait 2 weeks after Labor Day weekend to see what the data shows, Labor Day being the last kind of big holiday before school, but now we don't have school in most of the states, so I'm not sure that that's really relevant. But our recommendation was that we make that we wait until September 21st. So we're kind of waiting to see what you do and what Wayne recommends from the state. I don't know if we're going to get a report from Wayne today or if we've heard anything recently from the state. But that's why we drafted the letter, and we're glad that you have slowed down a bit. Seems like you have, and we follow very closely as a committee what the commissioners will be doing as far as going to phase 2. I'll be glad to answer any questions if the commissioners have any.
Okay, thank you, Gary. And I'll say up front, I felt it was important to hear from the Public Health Advisory Committee, regardless of how I voted on the issue of going to phase 2. And as you noted, it's the first time that the committee has actually made a recommendation, and they are Public Health Advisory. So thank you. And with that, Commissioner Jacobson, and how are we doing on time? Because I think we've got a critical decision we're going to have to make here soon, and I want you to be present.
Yeah, I have to get out of here in about 6 minutes. I just wanted to respond to Gary and say thank you for coming. And also, Wayne and I did receive, actually right before this meeting, a very quick response back from the OHA director in regards to the letter that we did send last week seeking clarity on phase 2. So we do have that letter that Wayne can read. I think they are intending on maybe sending us a more thoughtful response, but I had pushed them earlier today to try to get some type of clarity back before our meeting at 3 o'clock. We do have at least some clarity provided today.
Anything else, Commissioner Jacobson?
No, that's it for now. Thanks. And thanks, Gary.
Yeah, thank you. Commissioner Hall.
In the interests of time, I'm going to forego any questions, but really want to thank Gary and really thank all the members of the Public Health Advisory Committee for their commitment of time and thoughtful evaluation of these issues.
And I would second that. And again, in the interest of time, because I think we do have to make a decision relative to what action we're going to take, recognizing that the governor's letter gives us, I guess, gives the county the go-ahead, subject to still to be determined data on Tuesday, the 8th, and this would be our last scheduled meeting. So Wayne, give us a quick update on phase 2, and then I'll see if the commissioners would like to take any action.
Thank you, commissioners. And as you recall, subject to your direction, I sent off a letter to Oregon Health Authority, to Director Allen and Dr. Seidlinger, asking them to give us more information on metrics. They did give us a quick response, and let me try and go through that and what they said. First of all, what we wanted to know is what metrics are they going to actually be looking at to give us further guidance on a decision on whether we move forward on September 8th. They said that first and foremost, they're going to look at positivity, and they'd be looking for a positivity rate to be stable or decreasing. They gave us a time in which they will actually measure. That measurement will be taken on data through August 30th. And in fact, all the public health indicators they will examine will be with data through August 30th. What they said is they should be able to give us guidance on these metrics, though, by Wednesday. So, we don't have the actual numbers today. We just know that we'll get that guidance. In terms of the other 5 public health metrics, that's also, again, using August 30th as the date in which they'll look at those particular metrics. And they said that although they want us to be able to meet all 6 metrics, there's some room for judgment, what they call judgment calls. And they use as an example, the number of cases is going up by more than 5%, but it's a very low whole number of cases. So as we have looked at the data, we noticed that as we get lower cases and some of the rates, those numbers do jump up and down based on very few cases in there. But they said that we need to note that test positivity should not be rising. The new cases should not be increasing by more than 5%. Hospitalization should be trending down. And 95% or more of the new cases must be traced within 24 hours. And finally, 30% of the cases should be considered sporadic. I do know from the data that we received as of last Thursday, we met all of those metrics except for one. And that, again, that keeps going up and down throughout that. Finally, Director Allen said that they would be happy to make themselves available to us as needed for any further guidance. And I think the key part of the response, the initial response, was they will give us their read of the metrics on Wednesday. So again, being very cognizant of time, because we have not only this item, but we have a couple of other items that we need to discuss. One of the recommendations I have is, unless you're ready to act on this, and one other key component related to COVID, we may want to schedule an additional meeting on Wednesday or Thursday in order to actually get that response from OHA and determine whether or not we're going forward with the Tuesday deadline, unless you're ready to move on this right now. And let me talk about the other thing that I think we need to discuss, and that is that while you made a motion last week to extend the 24-hour hold to September 29th, that also incorporated the original language that we have with the hold, which really said that the 24-hour hold actually expires when we go into phase 2. And I need some clarification from you as, do you want this September 29th date to continue whether or not we're in phase 2, or do you want to honor that original intention? And this is a long time ago we set this, that said that we would remove the 24-hour hold when we go into phase 2. So those are 2 COVID related issues that we need to decide today or later in the week. All right, well, in the interest of time, I think as I see it, we have 2 choices. We can wait to get more information from the governor's office
and then have a special meeting on Thursday. But I'll be candid. We've got questionable data, as Director Austin has already indicated. The governor's office is going to be looking at data as of, I guess, yesterday, and we haven't had access to data as of a Sunday at all. I continue to worry about the positivity of the cases, tests that are being done, and Director Austin indicated that information is inaccurate. I don't think we'll have more information that clarifies that. I've already expressed my concerns about trying to get our schools open, and we've got the flu season, which Mr. Lehman mentioned. So I'm going to take the prerogative as the chair to try to make a decision, and I will move that we delay our application to go to phase 2 until Tuesday, September 29th, which would be consistent with our 24-hour hold period. It would give us time to gather data. We can go back and move that date backwards if we want, but I believe that would give us time for additional consideration to look at the impact of the Labor Day, to look at the impact of the flu season, and to try to get our schools open. So I will move for that action, subject to the criteria in the governor's letter, and see if there is a second.
Could I suggest a friendly amendment, Commissioner Hunt?
I'm open to it, sure.
Okay. My friendly amendment would be everything you just said. But in addition, it may not need to be wrapped up into the motion, but I think it's very important. In addition, I would like to see that the week before September 29th, that we try to have our BOC meeting with OHA, with Director Allen or a person of his choosing, so that we're not in this situation where we're trying to understand if we meet that criteria or we don't, or what judgment calls would need to be made. So it sounds like maybe Wednesdays is when they kind of go over that data. So maybe the Wednesday before or something like that, to be determined by our staff and theirs. But I would just add that with a meeting before OHA at our BOC meeting the week before.
I'm happy to accept that. And
Okay.
so your second is, I guess, on the table. Moved and seconded. Any other discussion? And again, I apologize if this appears to be a little bit rushed, but I recognize that Commissioner Jacobson has a critical need. Commissioner
I'm
Hall.
going to go ahead and.
Well, I was going to say, Commissioner Hall, any quick thoughts?
I'll forego comments. I will, because of the interests of time, but I intend to vote for the motion.
All right, if there's no more discussion, I'll call for a vote. All those in favor of the motion to delay phase 2 until our application to go to phase 2 until Tuesday, the 29th, subject to the governor's letter and subject to getting a meeting that includes OHA no later than Wednesday before the 29th, with a clear indication of where the county is as far as meeting the governor's criteria. Is that a fair restatement, Commissioner Jacobson? All those in favor say aye. Aye.
Aye.
Aye.
It's unanimous. Thank you all for your patience. Commissioner Jacobson, if you're free to leave whenever you need to. And
Thank
with
you.
that, go ahead.
I was going to say thank you. I'm sorry to have our meeting be rushed, but it is kind of an urgent family matter I got to deal with. So I'm going to go ahead and sign off now. Thank you.
Well, the decision was unanimous, so we're all on the same page. And you're excused. Be safe and stay healthy. All right. Is there anything else, Council Belmont, you need from us on phase 2?
No, I think you've given me clarification on both the 24-hour hold and on the target date for phase 2.
Okay. Commissioner Hall, I'll give you the opportunity to comment. Again, I apologize for the rushed process, but I wanted to make sure that Commissioner Jacobson was a part of it.
Understood. Yeah, this is something I have really struggled with. Well, we all have, and we continue to struggle with. But I think there are definitely concerning trends. Our numbers overall are headed in the right direction, but obviously there's still a lot of COVID out there, and though it's not going away, not now or not anytime in the future. And just one thing that Commissioner Jacobson said that kind of resonates with me is the fact that, well, gee, if we ever are going to open schools in K-3, that those communities are all phase 2 counties. And if we aren't going to give people the chance to show that they can manage with the additional opportunities that phase 2 offers, I don't know how we ever get to the point of people being responsible enough that we can hit the metrics, and the state and the school district can feel like they can open up safely. So still a lot, I think, for all of us to consider and ponder, and hopefully now we've got a little bit more breathing room to evaluate this decision as we get closer to the 29th.
Well said. I appreciate your comments. Anything, Director Austin?
No, not at this time. I would like to talk to maybe you, Commissioner Hunt, about further data needs that might help as we move towards our phase 2 date now.
All right, I'll be happy to do that. I'm sure we can find some time after today. And I would say that just quickly, the demographic data that you provided to me is very powerful. The younger aged individuals is where the virus is spreading most rapidly. When you look at the ethnicity of the cases, even though there's a large percent that is considered other, and I know we've discussed the efforts to try to clarify that, but the information, I believe, is really not available because it's being collected by the state. But even with that data, there's 51% are Hispanic or Latinx, and less than 10% of our county is Latinx and Hispanic. So clearly a disproportionate burden on that segment of our population. So I guess simply said, I think right now the data we're getting is very good, but maybe between now and the next few days, Commissioner Hall or Commissioner Jacobson could also reach out if there's other data that they would like.
Yes, great. I appreciate that so much. Thank you.
Okay, thank you. Keep up the good work. And,
thank you.
And I've said it before, but I'll say it again. It can't be said enough. Thanks to everybody in public health and in health and human services and other department of the county. I know everybody's working extraordinarily hard, and it is truly appreciated. So thank you.
Thank you for your leadership. Appreciate it.
Okay, thank you. All right, we'll move to reports. Commissioner Hall, any reports?
Not at this time, thanks.
I think, yeah, there's a lot to report, but no commissioner reports. I'll pass also. All right, next we have a decision and a discussion item on, a decision item, action item on extending the declaration of emergency. Wayne, talk to us.
Commissioners, we had the last time that we had extended our declaration of emergency, it coincided with the state's declaration of emergency, which expires after 60 days coming up here on September 3rd, is I think their date. And since this is the last meeting before, or pretty close to the last meeting before that time, we felt it was necessary to go ahead and extend the emergency declaration, since this, as you have discussed previously here, this is not going away anytime soon. We did have some contact with folks who have contact with the state to see whether or not the governor's going to be extending the declaration, and we understand she will, and that she will extend it for another 60 days. So we're recommending that you, in this extension of our emergency declaration, that we go out to, and I want to make sure I get the right date here, November 3rd of 2020.
Commissioner Hall, any questions?
No questions. I'd be glad to move that we extend the emergency to November 3rd, 2020.
Okay, I'll second. That's the emergency declaration of the county to November 3rd. I've seconded it. All those in favor say aye. Aye.
Aye.
That motion carries. Thank you. Next on our decision action items is the GP Strategic Investment Program and the agreement between, I'll just say all of the interested parties, and Council Belmont.
Commissioners, thank you. We're back in front of you with this particular agreement, which entails an agreement between Lincoln County, the City of Toledo, and Georgia Pacific Toledo LLC to support an application by Georgia Pacific to enter into the Strategic Investment Program run by the State of Oregon, Business Oregon. We have actually discussed this many times. We've held a public hearing on this particular matter. We're back in front of you because the original agreement between the city, the county, and Georgia Pacific included a provision that would provide for a payment of a community service fee or CSF of 35% of the actual value of the savings and tax that would be distributed between the taxing entities who are impacted by this matter. This is something we all came to an agreement after we negotiated this particular contract between the parties. However, when we presented that to Business Oregon, they came back to us and said not that they had a problem with us requiring fees of 35%, but that we could only set the community service fee itself, which is established by statute at 25%. So that what we needed to do was create a separate fee for the additional 10%. So we had this discussion. We went back to the City of Toledo. We had actually originally come up with the concept of a community impact fee, or a CIF, in addition to the CSF. In our negotiations with GP, and actually had identified some specific purposes to use this additional money for. That did not go forward in the negotiations with GP, and CJ Drake is here and can explain. I think he did a good job explaining to the City of Toledo why Georgia Pacific did not want that part of this agreement. However, we can address some of those issues in the separate agreement we're going to have to do between the taxing entities. And that is something that we're not actually considering today, but has to be put together within 90 days after this particular agreement and the application of Georgia Pacific is approved by Business Oregon if we go forward. So this revised agreement was presented to the City of Toledo last week, and they did approve the revised agreement with the understanding that we will sit down and talk about in our agreement between the city, the county, the Port of Toledo, and the Greater Toledo Pool and Recreation District, the dissemination of these community impact fees to address some concerns that we have. And let me tell you the kinds of things that we've been talking about previously with, especially with the City of Toledo. And that is that this money could be utilized for additional environmental testing if we wanted to do it in that particular area. We could address workforce and affordable housing issues. We could address childcare. Some of the issues we're seeing, greater issues that we want to deal with in the community. And it's something that we can come to some kind of mutual agreement between the parties as to how we can spend that additional money. So with that explanation in front of the City of Toledo, they did adopt this particular agreement, and we'll sit down at the table where I'm going to convene all the additional parties together, representatives from the parties, to talk about the separate agreement we will do to talk about the community impact fee and go forward on that particular request. The second item, I'm going to go ahead and talk about it, that you have in your packet is...
Well, excuse me, Council Belmont, I'm going to interrupt you because the lack of Commissioner Jacobson when we're making these decisions, and I remember it was a split vote to go ahead with the agreement, and out of respect to Commissioner Hall and deference to Commissioner Hall, explain to me if we've already made a decision on the agreement, the SIP plan. What are we, I mean, are we redoing it? In which case, I think it's not fair to put Commissioner Hall on the spot without Commissioner Jacobson present.
Well, I think what we are doing here, the only thing that is different in this case from what we had discussed before was originally we were going to, this community impact fee was going to be distributed equally between all the taxing districts, the same way that the community service fee is distributed. And in our discussions with Toledo, this is why I'm bringing this back to you, discussions with Toledo, they wanted to say, no, the community impact fee should go back to the original concept of actually having the parties, not including GP, but the other parties, the public entities, agree on how that community impact fee is spent and to actually target some of these additional services that we want to use the monies for. So that would be the difference between what we were talking about before and where we are today.
Commissioner
Okay.
Hunt,
Yes, go ahead.
just if I could jump in, I appreciate your concern. You know, we had the policy discussion on this. We voted. I was on the losing end, and that happens to all of us sometimes. So given that the policy choice has been made, and now that this agreement essentially is, I think, would you say it's fair to say, Mr. Belmont, it's in execution of a policy decision already made. You know, with that understanding, I'd be happy to vote for it so we could move this along.
And that is correct.
Okay. All right. Well, thank you, Commissioner Hall. And I would not say you were on the losing end. I would just say your end was different than our end.
That's right. That's right. Okay. Thank you. Thank you, Commissioner Hunt.
All right. In that case, Council Belmont, why don't you go ahead with the order? I believe you're going to discuss that, and then we can take action on both items individually, but we'll take them after you've concluded your discussion.
And thank you, Commissioner Hunt. So the second item is that under the statute, Georgia Pacific has already made an application to Business Oregon, but before Business Oregon can make their determination on the eligibility and move forward with approving the application, there needs to be what they call an official action by the Board of Commissioners. And this is what I've crafted to meet their requirements for an official action. And so it just simply notes that we have reached an agreement between Georgia Pacific, the county, and the city of Toledo that contains the statutorily required terms and the additional local requirements desired by the parties. And this is an official request that they determine whether the application qualifies for the strategic investment program and receives a tax exemption as authorized by law.
Okay. Commissioner Hall, do you have any questions? I know CJ Drake from GP is available, but I think at least I have a pretty clear understanding of what's happening and why. Any questions from you, Commissioner Hall?
None, thank you.
In which case, why don't we take these each individually? I'll entertain a motion on the agreement.
I would move for approval of the GP Strategic Investment Program agreement between GP, the City of Toledo, and Lincoln County.
And I'll second that. All those in favor say aye. Aye.
Aye.
That motion carries. Thank you. And on the order?
I would move for approval of the order requesting Oregon Business Development Commission to determine GP's eligibility for the SIP application.
And I'll second it. All those in favor say aye. Aye.
Aye.
That motion carries. And CJ, thank you for being at least available should we have questions. I appreciate that. And enjoy what remains of your afternoon.
Thank you. Commissioner Hunt,
Yes.
may I ask a question?
You may ask a question or comment. I should have given you the opportunity. Please go ahead.
Thank you. It's just a technical question for Mr. Belmont. So at this
Sure.
point, is the county going to forward the agreement and the request to Business Oregon for further review?
Yes, we're going to get signatures on all the documents that we need here, and then we'll forward it on to Business Oregon.
Okay, so Mr. Belmont, if you're going to need the general manager's signature here on that, you can just forward it directly to me and I'll take care of that and send it back to you.
All right, thank you, CJ.
Thank you.
And again, CJ, I'll apologize. I think I was still in a little bit of the time deadline mode. So
Not at all.
again,
Not at all.
should have given you an opportunity to comment. Appreciate your presence.
Thank you for your support.
All right. Let's see, with that, I believe that concludes our agenda. Any last comments, Commissioner Hall?
Nope.
All right, with that, the next meeting of the Board of Commissioners will be on Tuesday. Monday is Labor Day, and most of the county offices will be closed. That is a national holiday. So our next meeting will be on Tuesday, September 8th at 3 p.m. And until then, we are adjourned. Thank you all.